Hi all, today our topic of discussion is going to be about inlay wax. So inlay wax can be asked as a short note. So any short note or any essay, if it is asked, it's better you put start off by putting a content box. It will help you in fetching you more marks. So talking about the introduction, waxes are used for high precision work in dentistry like patterns for metal casting. They are also used for taking an impression as oxidative nickel material. So because it has got a very good properties like plasticity, low melting range, combustibility, non-toxic nature, and most of it is of low cost. And about definition, it's given by Ansavis. It's nothing but a thermoplastic moldable material which is usually solid at room temperature, but when it's subjected to a higher temperature, it becomes low viscosity liquid. It will flow easily, and they are nothing but esters of fatty acid, alcohol, or hydrocarbons, and they are insoluble in water but soluble in organic solvents. So it is just a direct definition from your Ansavis. And talking about history, not all of this is very important. Probably for an undergraduate level, you need to be very sure about two people. That is Phil Brook, who actually gave this first cast inlay in the year of 1897, and William Taggart, who gave this lost wax technique in the year of 1907. And talking about the sources, so basically, you obtain waxes from various sources like plant, animal, insect, and minerals and synthetic waxes. And talking about your classification, so you have to actually write it according to these headings. Then it will be easily, I mean, you can, it's very easy to memorize. At the same time, you can easily get marks if you're going to segregate the whole topic into different headings. Okay. So talking about classification, there are different type of classification like according to origin, which I told initially, and according to the use, a pattern wax, impression wax, and processing wax. That's nothing but a pattern wax means it's nothing but it's used to record your like what to say, any shapes and molds like that. And also for impression, you can use this wax for bite registration and all. And sometimes like a processing wax, which are nothing but an auxiliary purpose, like for boxing and beading, you can use. It's a very important classification. And sometimes according to ADA also, it is classified as type 1 and type 2. So whatever I'm talking now is about a general about the dental wax. So we'll be getting into inlay wax after this. And basically all the waxes have these properties. They have a appropriate melting range for each of it, and they have a property called as thermal expansion. These have got a high CTE, because when we heat it will expand like anything, and when we cool it, it will shrink like anything. So because of all these, we have a lot of residual stress and distortion being created in it. So we have to make sure whenever we do any procedure with the help of these waxes, we have to keep one thing in mind. Try to invest and do the casting as early as possible if you are using a wax, because they have high chances of distortion if it is being left for longer time. Okay. And they have got a good mechanical properties and excellent flow property is very, very important to record the minute details. And they have a property called as ductility also, which can be ability to reshape without any much distortion. Talking about composition, the basic composition is paraffin, and it has got excellent flow, but the problem is that it becomes flaky when we trim. So to modify this, a lot of other agents like beeswax, carnauba wax, candelilla, and sericin was added, and some colorants are also being added. Uses we spoke initially for bite registration, boxing, beading, for impressions and all. Now this is very important, inlay wax. So for inlay wax, the ADA specification number is 4. So what is an inlay wax? Basically we do something called an inlay cavity preparation, right? When your caries is very wide and all those things, you do this inlay cavity. So for that, you will not be placing a direct restoration. You will be sending it to lab for doing a casting and a metal metal restorations you will be getting, which will loot on the patient's cavity, right? So to record the cavity, you do use some waxes that is called as the inlay wax. They are nothing but a specialized dental wax which are applied onto the prepared cavity or to the dice. You can either do it directly in the patient mouth, or you can do it as an indirect technique that is called as a dice. You prepare a die from the impression to make this inlay wax patterns. Okay, so after you make this wax pattern, you will actually put it to a burnout procedure where you will be removing all the waxes and to create a proper mold shape. After this, in the lab they will be doing a casting procedure wherein your molten metal will enter this mold space, and you will get this you'll get your cast metal restoration. And the process of removing this wax is called as a lost wax technique. Understood? So this is basically about a inlay wax. So again, ADA specification number is 4, and they are classified as type 1 and type 2. Type 1 is nothing but a medium wax, type 2 is a soft wax. So medium wax is highly used for a direct pattern. See, the thing is that medium wax means it will have a minimal flow. It will not flow like anything, because direct means you're directly doing it in the patient mode. If it is flowing like anything, it will go and flow everywhere inside your mouth, right? So to avoid this, you basically use a medium wax. Whereas in type 2, you use it for an indirect preparation method. Like what is indirect? You take an impression and you pour the cast, and you will do the wax pattern on the die that you have got. So for that, you need to have an adequate flow. So for that, you can use a soft wax. So basically, this is very important: medium wax, soft wax. Medium wax for direct pattern, soft wax for your indirect pattern. Again, the requirements are same. One important Viva question that they can ask is, what is the CTE value for inlay wax? CTE is nothing but your coefficient of thermal expansion. Always remember, your inlay wax has got the maximum CTE value, that is 350 into 10 to the power of minus 6 per degree Celsius. This is a very, very important Viva question. Okay, and the composition, everything is the same. So manipulation, how you will do: first you have to soften the wax. You can directly soften in the Bunsen burner, or you can soften it in the warm water, or you can use an infrared lamps, or sometimes you can also use a wax annealer. So by doing it, you can soften the wax. So this is what I told: direct technique and indirect technique. So direct technique, the inlay waxes are available as pellets or sticks. So basically here they have shown it over the spirit lamp, and they will soften it, and you can directly place it inside the cavity. So before placing the wax inside the cavity, better you put some separating medium like petroleum jelly or Vaseline, so that it can easily come out. Okay. And this is an indirect technique where you will take an impression and you will pour the cast. The mold which you get is called as a die. So you will be preparing a wax pattern on the die, and this will be sent to the lab for the further procedure. Okay, this is the difference between direct pattern and indirect pattern. So in indirect pattern, you actually get more time to work on the wax pattern, right? So you can adjust more. Whereas in direct, you are working with saliva, patient cooperation, everything is very important. So each of this got some pros and cons. And in indirect pattern, how we are going to soften the wax, how we are going to adapt the wax. These are some methods called the dipping methods, where you will be taking some wax pellets and they will soften it. They will dip the dye into the that molten wax, and this is how they do the dipping method. And this is just a adding method. This is what we do mostly, wherein we just take a bit of wax, soften it in a flame, and then slowly adapt it on the dye. So yeah, and there are some specialized instruments for this inlay wax pattern preparation. These are called as a PKT instruments. Just know the name, no need to get inside so deep. Just know there are different instruments available, and that is called as a PKT carvers. So this is what PKT means, Dr. Peter K. Thomas. Okay, these are the various instruments. And there is one more classification apart from a direct and indirect technique. Indirect, we have two, that is open technique and closed technique. Open technique is nothing but a Voland's technique, and closed technique is nothing but a Starrup's technique. Voland's technique is a simple technique wherein you directly put your wax pattern inside the cavity and take it out. Whereas in closed technique, what we do now, we adapt a matrix band. A matrix is applied onto the tooth, and a separating medium is given. That is common, right? And what you do now, you take an inlay wax stick, you will soften and knead it. Then the softened tip is inside into the cavity. It's inserted inside the cavity, and you'll keep it there under pressure. You'll remove all the excess wax. You do the carving and etc. with the help of PKT instrument. Everything you will do. And after it sets, after it becomes hard at room temperature, you will remove the matrix band. So matrix band will come along with your wax pattern. So these are two different techniques. Okay. So these are the various guidelines for usage of instruments. This is not required for a UG level. So yeah, always make sure whenever you are using a wax, there are some criteria for its flow rate. This tableau column is very important. Try to memorize this, and always make sure after you do the burnout, do the casting as early as possible. Do not leave it for longer time, because when you more the time between your bonnet and casting, more will be a distortion. So in order to reduce your residual stress and distortion, it's better you do the casting as early as possible. If supposing there is any delay, you have to make sure you store it in appropriate temperatures. Okay, and when you do the burnout, you should also make sure you completely remove the wax, because if wax residues are present, it will interact with your molten metal that is entering during casting. It will react to form some carbon monoxide gas, which can result in some defects in casting, like distortion, which I already told, right? Because of stresses that happens, sometimes the surface discolorations, like contaminated casting, black casting, everything this results because of inadequate removal of wax during a burnout procedure. Okay, so with that we complete our inlay. It's a short note, so you just make sure you write all the short headings that I've mentioned in this PPT and try to fit 2 or 3 points inside that. Okay.